Hey, it's Hannah, and I am going to be discussing pneumonia. So, what is pneumonia and what happens to your body physiologically with pneumonia? So, pneumonia is a common lung infection, and it can be caused by virus, a fungi, or bacteria. And so, it's inflammation of the alveoli or the bronchi within the lungs. And so when the alveoli become inflamed, it swells up and fills with pus or fluid. And then it makes it very difficult to breathe. And whenever you breathe the oxygen, it makes it difficult for the oxygen to enter the bloodstream. And so something that you will see some of the signs and symptoms you see very common with pneumonia can be fever, chills, cough, and difficulty breathing. And of course, this can be something that could just be your normal cold, but with this, it makes it very, very difficult to breathe. And with that, when your body's fighting the infection, it becomes weakened, and the muscles become weakened, and they become sore as well. And the two systems that are mostly affected are going to be your immune and your respiratory system. So, what are contributing factors in the development of this condition? So, there's medical conditions such as you have cystic fibrosis, you have asthma, and the three major contributing medical conditions are COPD, heart disease, and diabetes. There can be weakened, suppressed immune system, such as HIV, AIDS, organ transplant, chemo, long-term steroid use, and autoimmune disorders that can contribute. Recent viral respiratory infections such as cold, laryngitis, the flu, and then age. Age is something that is one of the big contributing factors. You see an increased risk for children less than 2 years of age, and the older population, the elderly, so adults that are going to be older than 65 years of age. Health behaviors are something too that contribute, which that's with any of these pathologies and these diseases that we're learning about. If you don't take good care of your body, if you don't keep it well and healthy and strong, it makes it a lot easier for you to get pneumonia or to get anything else. It makes it very hard for your body to fight off all of these infections. And so smoking, drug or alcohol abuse increases your likelihood of getting pneumonia. Use of contaminated intravenous needles. And another thing is the environment exposure, so such as the chemicals or pollutants within the air that can contribute to this. So what are typical signs and symptoms? So I've already discussed a few of the ones from earlier. So the fever, the chills, the cough, difficulty breathing, those are some that are just like a common cold, but it's also something that's typical as your clinical picture for pneumonia. And you can have a productive cough with rusty or sputum and vicious infection within your sputum, dyspnea, tachypnea, rales. And complications of pneumonia can be lung abscess, pleuritis, which is inflammation of the pleura, cardiac failure. You can have chronic long-term disease, which is called honeycomb lung, which is very interesting, and I had to look that up. It's a radiological appearance of small cystic spaces filled with irregular, thickened walls composed of fibrous. So, radiologically, you can see that. And what are the most effective management strategies for a patient with pneumonia? So, there's medical interventions consist of antimicrobial medications specific to the invading organism. A lot of this can be treated with antibiotics, and if in severe cases, if you're hospitalized, and they will treat you with intravenous fluids, oxygen, antibiotics, and other breathing treatments. And how can this be managed in physical therapy, or are there special considerations or implications for this patient? So There are things that we can do within physical therapy for people with pneumonia. There's airway clearance techniques and postural drainage. There's exercises for strength and endurance, for recovery, which is an important part of rehabilitations. As I said earlier, people with pneumonia become very weak, and their muscles become weak and sore as well. And so, getting their strength and endurance back is something that's very important, and for their overall health. So, understanding implications. This is something that I saw that was very important in the book. Is understanding the implications for your patients, particularly the elderly, though. You hear pretty often and most common the elderly who get pneumonia, and it can be very detrimental to their health. And so it's something that the quicker they are up and the quicker they are out of bed and ambulating, the quicker they are able to get home, and it lessens the likelihood of complications such as pneumonia, which really with anything that we learn, the quicker you can get them up and moving, and getting their blood flowing, to the muscles, it just helps their overall health, get them to going, and hopefully home quicker, as I stated earlier. So that is something that we can do within physical therapy. So thank you, and bye.